What is AA amyloidosis? AA amyloidosis, also known as secondary amyloidosis or amyloid serum A protein, is a rare disorder where proteins in the body mutate, lose their three-dimensional structure, and form twisted clumps of misshapen fibrils known as amyloid deposits. These deposits accumulate in organs and tissues, leading to complications. AA amyloidosis arises due to chronic inflammatory conditions or diseases that elevate serum A protein levels in the bloodstream. Impact on the body. AA amyloidosis primarily affects the kidneys, but it can also damage the liver, spleen, stomach, and intestines. In rare cases, it affects the heart. This condition may also influence protein levels in urine and cholesterol levels. Prognosis and treatment. AA amyloidosis can be fatal if left untreated. However, by managing the underlying inflammatory condition, healthcare providers can effectively treat AA amyloidosis. Who is at risk? Anyone with a chronic inflammatory condition is at risk of developing AA amyloidosis. What causes AA amyloidosis? AA amyloidosis is a form of amyloidosis, known as a protein misfolding disorder. In normal circumstances, proteins are long molecules that form three-dimensional structures and perform a variety of essential functions in the body, such as providing energy, balancing fluids, aiding immunity, providing structural support, transporting materials, and regulating bodily processes. Typically, proteins exit the bloodstream once they complete their tasks. However, in protein misfolding disorders, proteins adopt abnormal shapes that cannot be removed or used by the body. In AA amyloidosis, these abnormal proteins aggregate, forming amyloid deposits or fibrils that accumulate in organs. Recent research has identified numerous medical conditions that can lead to AA amyloidosis. These conditions include certain blood cancers, bacterial infections, rheumatic diseases, and inflammatory bowel diseases. Additionally, some inherited conditions, such as periodic fever syndromes like familial Mediterranean fever, can cause AA amyloidosis. What are the symptoms of AA amyloidosis? AA amyloidosis commonly affects the kidneys, but it can also impact the liver, spleen, and stomach. Common symptoms and conditions that may indicate AA amyloidosis include swelling in the feet or legs. This may indicate kidney problems, including chronic kidney disease. Foamy or frothy urine. Changes in urine consistency can signal AA amyloidosis-related issues. Reduced urination. A decrease in urination frequency is a potential symptom. Persistent diarrhea. Chronic diarrhea can be associated with AA amyloidosis. Enlarged kidney. An increase in kidney size could indicate underlying issues. Enlarged liver. A swollen liver might result from AA amyloid deposits. Low blood pressure. Sudden drops in blood pressure may relate to AA amyloidosis affecting organ function. Nausea and vomiting. These symptoms could be a response to the impact of AA amyloidosis on the body. If you experience any of these symptoms or suspect AA amyloidosis due to your medical history or family background, it is crucial to consult a healthcare professional. Early diagnosis and intervention can significantly improve the management of the condition and help prevent further complications. Timely medical attention can make a substantial difference in your overall health and well-being. Understanding the causes and symptoms of AA amyloidosis empowers you to take control of your health and seek appropriate medical care when needed. Diagnosing AA amyloidosis. Healthcare providers diagnose AA amyloidosis through a series of biopsies. Fat pad biopsy. A small sample of abdominal fat just under the skin is taken. Organ biopsy. A small sample of tissue from the affected organ is taken. Other tests may be conducted to rule out AL amyloidosis, another form of amyloidosis with similar symptoms. However, AL amyloidosis is a more aggressive form of the disease. Treating AA amyloidosis. AA amyloidosis is caused by a chronic inflammatory condition that leads to the accumulation of abnormal proteins in clumps on organs. Treatment involves addressing the underlying inflammatory condition, which reduces the inflammation that causes AA amyloidosis. As inflammation decreases, symptoms of AA amyloidosis typically improve. Medications that specifically treat active AA amyloidosis may also be used. Ongoing research aims to develop additional treatments to clear amyloid fibrils from the bloodstream before they build up in organs. Lab-made antibodies targeting and clearing amyloid fibrils already lodged in organs are also in development. Preventing AA amyloidosis. To prevent AA amyloidosis, it is essential to seek timely treatment for chronic inflammatory diseases such as rheumatoid arthritis, which increase the amount of a certain protein in the bloodstream. Curability of AA amyloidosis. AA amyloidosis can be managed by treating the underlying inflammatory condition that causes it. Early diagnosis and treatment are crucial for effective management. Self-care for AA amyloidosis. Patients with AA amyloidosis should work closely with their healthcare providers to treat the underlying inflammatory condition. Numerous diseases and conditions causing long-lasting inflammation are linked to AA amyloidosis. Patients should discuss with their healthcare providers how their specific condition caused AA amyloidosis and the treatment plan for their inflammatory condition.